For our second speaker, Dr. Mohammed Al Katan from Kuwait. He holds a PhD in exercise physiology at the University of Texas at Austin. Dr. Al Katan has many research related to exercise physiology, and altogether he has a 12 peer-reviewed article published. And note that Dr. Mohammed, he's the only GCC citizen got awarded by SESM for his research contribution for his PhD. Dr. Mohammed, please.
Thank you, Dr. Fuad, for the introduction. I'm going to talk about the improved function capacity after swimming and cycling training in patients with osteoarthritis. Just leave that. No disclosure. Throughout my presentation, I'm going to talk about arthritis in general, then I'll be more specific talking about the role of exercise to manage this disease, and to be more specific talking about the swimming as a mode of exercise, and then we're going to make some conclusion at the end. Arthritis is considered to be the first disease which caused disability in the world, comparing with other chronic diseases such as diabetes, heart problem, as you can see there at the top, red bar. What is osteoarthritis? In a simple way, if you see the knee here, on the left side, you have a femur and tibia. At the end of the femur, you have cartilages, which connect the end of the bone. The main function of the cartilages is to prevent the function of the bone, as well as to let the joint move easily. When this cartilages break down, like in the right side here, the bone going to expose, and that's going to be the case of osteoarthritis. And in the X-ray here, you can see a very nice space between the tibia and the femur. This due to the cartilages. If this cartilage break down, you can see there is no space, and this going to cause what we could call it the bone-on-bone osteoarthritis. And imagine if you have this kind of knee, if you try to move this knee to do any physical activity, it's going to cause a lot of pain. That is why one of the most symptoms for people with osteoarthritis is pain. This pain is usually happen when you try to move the joint, as well as joint stiffness and swelling, decreased range of motion, redness of the skin around the joint. Risk factor, unfortunately, we don't know the exact reason for this disease. However, there is some risk factor could trigger this disease, such as aging. Older people have at higher risk compared with younger people. Sex, female at higher risk comparing with male. Like other chronic diseases, if this disease run in your family, you might actually have it. Obesity is, if you are obese, it could double the risk to have osteoarthritis. And also sport could contribute or could trigger osteoarthritis. I'm going to talk a little bit about sport, how sport could initiate osteoarthritis. There is two main theories. The first theory is if you participate in sport as a specific mode, such as soccer or football or long distance running, the theory said that you have the high loading, and over and over and over throughout the years, you're going to develop osteoarthritis. The second theory is if you have injury, a sport injury, this could cause to osteoarthritis. We're not going to really talk about which one is more common. However, both scenarios could lead to stop participating in sport. Now, it is really a chronic disease. Many people suffer from this disease. How could we manage this disease? Basically, medication as well as cortisol injection. This is the easiest way that people could do. Unfortunately, this is not the solution, or you could not treat this disease by taking medication or cortisol shots, but it's actually maybe it's not good, because when you take the pain off, you're going to probably do more loading on your joint, which could actually make the situation worse. At advanced stage, you could do joint replacement. This is also, even though we have advanced medical surgery here, but it still is invasive and need a lot of work for recovery. Physical activity is a really good strategy to manage this disease. This is why the American College of Rheumatology, they highly recommended people with osteoarthritis to exercise, because could control this disease or reduce the pain. What kind of mode of exercise? They suggested walking, water aerobics, swimming, cycling, yoga, tai chi, and stretching. They prescribe 3 to 5 times per week. The duration for the session is 30 to 45 minutes. Now, with all this recommendation, we could see this a group of researchers find out that people who do not have any disease, they have some time of inactivity. And we are complaining about obesity. They are not doing any kind of activity, which is going to be more than people or normal people. Which surprised me is to find out that people with osteoarthritis, they are less active than people with obesity. And the problem is people with both arthritis and obesity, they are more and less active, or they have more sedentary time comparing with the 3 groups. It's really important slide, because we said that obesity is a risk factor for osteoarthritis. This actually could develop osteoarthritis, as well as if you have osteoarthritis, you might not to exercise too much, and this is going to lead to this bar. You're going to be obese, you're going to have osteoarthritis, it's going to develop chronic diseases such as diabetes, hypertension, and cancer. I tried really to find out why people with osteoarthritis do not exercise. And trying to read more and more articles, and I found that here in the same recommendation from the American College of Rheumatology, they said for the person with arthritis, appropriate exercise is very important. Then we're talking about the mode of exercise. Let's see other organizations, such as CDC, they have, or they said, or it suggests low impact aerobic exercise, such as what? Swimming. Swimming is one mode of exercise. The American College of Rheumatology, as well as CDC, recommended. There is another organization called Arthritis Foundation. They have a really huge campaign called the Fight Arthritis Pain, and they have this online, and you can see this guy saying, my weapon in the fight against arthritis, and this guy is swimming. Move on to another institute, which is the National Institute of Arthritis and Musculoskeletal Diseases, and their recommendation is there is a guy who is swimming, meaning that this organization highly recommended swimming. I am interested in swimming because it has a really good advantages. The first thing is considered to be non-weight-bearing activity. If you are in supine position, you're not going to put any load in your joints, especially the knee or the hip, as well as is considered to be upper body as well as lower body exercise. It's a very, very good mode of exercise that you could do here in the JCC region since it's really hot in the summer. Another thing, there is a cross-section study said that swimmers, they have less injury rates comparing with other mode of exercise such as cyclists and runners, triathlon. Trying to find out a scientific proof could support that swimming is really safe for people with osteoarthritis. Unfortunately, I did not find any single study that support this evidence. And all these organizations saying that swimming is a good mode of exercise for people with osteoarthritis is not existed. And this is why I did the study. The purpose of the study was to determine the effect of swimming compared with cycling exercise intervention on pain, physical function, mobility, and strength in patients with osteoarthritis. I recruited 48 participants. They did pre-test, then I randomly assigned them into two groups, the cycling group and the swimming group. And then they did exercise program for 12 weeks. And then they did the post-test. For the exercise intervention, they did exercise 3 times per week at 60 to 70 heart rate reserved, and they did 40 to 45 minutes per session. For the measurement, I did a well-validated questionnaire, which is a WOMAC questionnaire. It's designed for people with osteoarthritis, which could measure 3 domains. The first one is pain, physical function, and stiffness. I also measure their strength, upper and lower body strength, using the Biodex for the lower body. At angular velocity of 60 degrees per second, I measure their upper body strength using the hand grip. For the mobility, I use a 6-minute walk test. Basically, participants walk as fast as they could for 6 minutes. My job is to measure their distance that they covered in 6 minutes. I also measured lean mass, fat mass, visceral adipose tissue using the body composition IDEXA. And also I measured their waist and hip circumference. For the result, most of my participants were female. They're old. Most of them, they have knee osteoarthritis, which is 60% in the cycling group and 75% in the swimming group. For the compliance, 97% for the cycling, and swimming is 98%, meaning that they almost attend all exercise sessions. For the change in selected participant characteristic, both swimming and cycling reduce body mass as well as waist circumference and hip circumference and visceral adipose tissue, as well as both groups demonstrate that people exercise or do more activity. For the questionnaire, both exercise modes, the cycling and swimming, significantly improve or reduce pain, reduce stiffness, and improve physical function. For the hand grip, both exercise, the cycling as well as swimming, improve their right and left hands strength. For the knee extension and flexion, both exercise improve their strength. For the extension, for the cycling as well as swimming, as well as for the flexion, significantly. 6-minute walk test, both exercise improve the walk distance significantly in both groups, cycling and swimming. Now, for the general conclusion, I could say that regular swimming and cycling exercise improve upper and lower body strength, mobility, and reduce self-repair pain score, as well as swimming and cycling are effective non-weight-bearing activity exercise that could improve OA symptoms management. Going back to our slide that for sport, I highly suggest that if you are a long distance running or soccer that has a really high impact to your knee, I suggest that to limit participating in high impact loading sport, moderate participation, or try to use different mode of exercise such as swimming or cycling. In regard to injuries, try to wear appropriate activity, warm up, cool down, protective equipment and playing equipment, as well as still try to use different mode of exercise such as swimming and cycling. This is hopefully we could continue participating in sport. I published these 2 studies. Unfortunately, I didn't have the time to talk about the cardio section of it, but if you would like to go for it, it's published in American Journal of Cardiology 2 months ago, And the function one has been published 2 months ago as well in the Journal of Rheumatology. I would like to thank all of you for listening, as well as I would like to thank all people who organized this event. It's really nice and very good to see all of you, as well as I would like to thank Aspetar for the invitation.